Let me know when you got it recorded.
It's certain.
Okay, so welcome to the Board of Trustees Platte County Health Department meeting. It is February 19th, 6 p.m. Let's do a roll call. Kim?
Here, present.
Me, present. Zach?
Zach, present.
Susan?
Here.
Okay, so who's missing? Oh, Dr. Chappé's not here yet. Okay, let's do the Pledge of Allegiance. I pledge allegiance
Allegiance to the flag of the United States of America and to the republic
Which
stands
one
nation under God, indivisible, with liberty and justice for all.
So from now on, it'll be whoever's on has to run the Pledge of Allegiance.
That's right.
Okay, so is there any guests or public attendees that we need to be aware of? Maybe online? Anybody?
Not officially, I guess, but I will introduce. This is my new public health nurse team lead, Emma Rose. So she was kind of curious of how this whole process goes and asked if she'd come and join and watch you guys. So
Amaro, is that the name?
Yeah,
Oh, welcome. Okay, you want to run from this? Oh, we gotta do the minutes. Anybody had a chance to look at the previous board minutes? Any questions, any concern?
No.
Susan, are you good?
I'm good.
Okay, do we have a motion to accept?
I move we accept the minutes.
Do we have a second?
a second.
Further discussion? Let's vote. Kim?
Yes.
Susan?
Yes.
Me? Yes. Zach?
Yes.
Okay. Now it's up to you. Go for it. Run the show, Andrew.
Done today, Andrew.
All right,
Come on. Time is money.
okay. So vital records and food handler cards, as you can see, we're off to a great start. We have more in January than we have other years, past 5 years. Go ahead and scroll down. You see in the chart there, whenever I see a chart and it has such an anomaly where it drops down, I always think that's a data entry error or something. So if any of you looked at that and thought, oh, why does that number drop down to 180 or whatever it was? I actually went back and looked at the numbers. That was that number for that year. So for whatever reason, the copies were just, people only got one copy that year for whatever reason in 2023, but I went back and looked. So anyway, the big news on the HVAC system is the heat, which we haven't needed for a little over a month, is actually working. We had a very short time where it was really, really cold and the heat wasn't working. The heat wasn't working. Taylor, Frank, and I kept telling the people the heat's not working. We actually narrowed it down. We put little sensors in our, you can actually see one up in the vents, and we picked a weekend and I was checking it and I'm like, okay, it's not working. It's not working. Then I got above freezing and it started working. And I'm like, pretty clear the auxiliary heat is not working. And we have been telling them that the thermostats probably are not wired right. They kept telling us, no, it's right, it's right. They came out, finally called Train, rewired the thermostats. It started working perfectly. Then they told us, oh, the thermostats weren't wired right. I'm so glad they figured that out. We had no idea what was wrong. So everything is working correctly
But
now.
it's even worse than that because you mentioned it multiple times that something's wrong. And they said, oh, no.
They told us all number of things, like it's us, it's you, not me. It was ridiculous, the excuses. And it had been going on for months, but they are fixed. Now, to be fair, someone did tell him that was the correct way, but we had been telling them, no, we know we have auxiliary heat. We know it is not working, but what do we know? But anyway, it is now fixed and working. So I think the week after that, roughly about a week after, the heating was all kind of, and so it was still really cold. But on January 23rd, we had a new water feature. And there it is in the picture. It's actually not very water-like because it's all frozen, because it was really cold out. I actually got a call. We have some staff that get in about 7:30, and they said, "Hey, there's a new water feature out on 110th Street. We have a water main break."
This is the city of Fountains.
Exactly. So we called it. They said, "Okay, we'll let people know." It was running out onto Ambassador. No one came. No one came. About 12 o'clock, they came. They shut it off. So we ended up having to close the building at 1 o'clock because we can't operate without toilets or being able to wash our hands. Amazingly, and that was a weekend that it was very cold all weekend, and we got snow and stuff. But they had it fixed for us by 8 o'clock on Monday morning. I think some of my staff would have liked to have been not working, but the water was back on. We were back in the office. Way to go, Kansas City Water.
Yeah.
It was impressive.
Yeah.
Because the weather was pretty terrible all weekend, and they had it back up and running. So
now we need it to break on the other side of our parking lot.
So
Their exit. That would break. That would be awesome.
So I had told Dr. Kingsley when we had first moved in, one of our water main breaks was on the concrete apron into this first entrance. And so where it broke was that concrete apron. They had to tear it all up, but they had to replace all that concrete for us. And so it was a free concrete apron. The other apron, which is towards the east, is kind of needs to be replaced, but it costs like $30,000. So it would be really nice if that would break so they could replace it.
Yes.
For free.
We're just thinking ahead. That's all.
Taylor and or Rebecca will probably talk about it, or they can talk about it now, so I don't steal all the thunder. But we had talked about the budget back in November and December, and one of the things that we were counting on was this accreditation assistance contract in the amount of $227,039.
That's nice.
We had originally submitted that in the amount of $450,000, and we pretty much got laughed at when we had submitted it. And our colleagues across the state, they all laughed at us too. And I think ours was the highest number that was submitted. And even the 227 was on the high side for what others had submitted. But this is one of the few grants with federal pass-through funding that is left. And so, and it is something we truly do use. And we weren't going to leave any money on the table. So we were pretty insistent that we wanted to submit for everything that we were going to spend. And it pays a large portion of Rebecca's salary. And portions of other people's, but well, but we spend the money. And we also, and we've talked about it, and I know Dr. Kingsley and Dr. Chaffee have heard us say this to a lot of other health departments, but everything we do here, we always share with other health departments. It's one of our big beliefs that the work we do here, we want to share with other health departments and bring them along. So that was kind of our pitch. As they were evaluating the different proposals, Taylor and I were both trying to whisper and maybe yell, slap, whisper, I don't know, but force, I don't know, talk to the state folks and just reaffirm that message. Hey, don't forget, this money is going to go like 3 times as far when you give it to the Platte County Health Department. But our colleagues across the state, they were not, like, they weren't even at this level. And so while we're not necessarily surprised, but this is the entire amount that we had submitted on our second try, and we got it all. So good job, Rebecca and Taylor. We got all the money that we asked for. I think Taylor likes money, so she was pretty pumped up to get it all. Rebecca was like, I don't know if we're going to get it, but she likes money too, so everyone's pretty happy.
So this covers pretty much all our expenses for this whole project?
No, but it does make us have a balanced budget, something like that.
So it'll cover our accreditation fee for this year, which is at $8,400, and then it's the salaries of about 7, or parts of the salaries of 7 employees. It's a majority of Rebecca's salaries, and then parts of mine, parts of Andrew's, and parts of a couple other people who. And we didn't put, well, I think the first time around, we tried to put everyone who was involved with accreditation, and they came back to us and said it needs to be lower because I think they only had $2.5 million to give out. So since we asked for $500,000, like, or almost $500,000, they were like,
So we got about 10% of the budget for the entire state, but
so.
yeah, we were
Congratulations.
aggressive in what we asked for,
I like it.
but if you don't ask, you don't get it.
Squeak wheel gets grease.
Right, and we did say we're gonna, we're willing to share things with other people. We've already been doing that, and we're gonna be continuing to do that, so we were really excited to see that.
Almost done.
So we work hard, we play hard, and we apparently ask for money hard.
Yes, we do.
There you go.
But we were, so Michelle, she was super happy because she, polices our budget. And when she saw that come through, she sent a little emoji of a happy dancing kitten. And that is high praise when you get an emoji from Michelle. Right? Sonia?
I would believe that, yeah.
Right, because she doesn't send happy dancing kittens for just anything. But when you balance her budget, she is very happy. So our budget at the end of January, we have our revenues were $2,421,078, or 57.9% of the budget. And I think everyone knows our monies come in at the beginning of the year and at the end of the year. And then our expenditures were pretty much right on track. We're at 284,282, or 6.8% of the total budget. Our money market account, we are at 2,684,387, and then our lease purchase debt obligation, we're just over $2 million at $2,080,481. Did you have a question, Susan?
No, I'm just shaking
Oh,
yay.
Okay. And then our customer service survey, I think I had mentioned, I think maybe it was our December numbers were a little lower. I had said something at our staff meeting. And I think because we only had like 13 responses in December, but people must have taken that to heart and said, fill out the survey, fill out the survey. So we had 23 responses in January. Overall, again, very positive. Go ahead and scroll down.
And I think with that too, I think having like that digital display back in the clinic area, because we did have a lot of feedback from that. I think that helps too, because there is the QR code that pops up on there for it.
How would you rate our service?
Should I say it? Should I say it? We finally got a 3.
And Dr.
We're shutting this place down now.
Too, but,
We're done. No more. You guys are all fired. So we got a 3.
Wait, what service did they give us?
So the service they got
I've been with it.
for how friendly and helpful was the staff, it was Dr. Kingsley they were rating.
Yeah.
It was
I'm
actually,
not giving out the surveys anymore after that.
it was a birth and death certificate, and I had shown Dr. Kingsley, they had rated everything, like the stuff they wrote, everything was really positive. So there was really nothing negative, and it was just a birth and death certificate, and they were happy, they got what they needed. So why it was rated a 3 doesn't really make any,
And they gave us a 5 or something else, right?
so,
It was the person that thought the bathroom smelled weird.
no, it was a different person.
That's that was my assumption.
So did they say why it smells weird?
No, they just said it smelled
Somebody was
weird.
in there right before him.
Yeah,
Yeah, that's probably the case.
the one likes gin. I'll give it another one.
But then again, like always these things, I love reading the comments and, you know, what did you like about your visit? You know, the staff, the decor, the friendliness, customer service, everyone was so kind. We have a couple people that always kind of seem to be, it's like 3 people, 3 or 4, but Jen Heater was the person this month that kind of
Cleans house.
got mentioned. And then you can go ahead, what can we do to improve?
Pay your staff more. Okay, who showed up? Which employee?
You know, I'm kind of thinking Emma, when she was interviewing, may have said that one, I'm not sure. But seeing more Jen, so I'm not sure, maybe that wasn't
Somebody-
her family.
Jen's family, maybe.
Taking people off.
Yeah, she gives them 2 lollipops when they come in for their service instead of just the
Okay.
one, so that kind of helps sweeten the deal.
Yeah, there's payoff.
But then, you know, always just great to see what people wrote. Everything went smoothly, everything was clean. Bathroom did smell weird, so I'm not sure.
Teachers need more energy. So I guess we have to start getting what monster drinks to everyone or what we gotta do.
But again, I have shared this with some of my colleagues. Somewhat, I'll be honest, somewhat just bragging, just about how,
Do it. Just do it.
well, it's pretty awesome when you have this kind of feedback.
Yeah.
But just what the response was and just the, you know, a $25 gift card, just kind of getting the feedback, getting people to do it, and then getting the staff buy-in to kind of promote this is wonderful. And it's not really that hard to do it when some of our folks have been doing this a long time and they're getting 2 people a month, because they're not getting any real feedback if you're only getting 2 a month. You know, 24 a year, when we're getting that a month, we're getting a lot more feedback from folks, so. But, and I think that's all I've got. Taylor?
All right, well, Andrew mentioned the accreditation assistance funding. I'll let Rebecca talk about accreditation updates. But so we had the Taste of the Northland event, and that ended up being sold out. So they sold 300 tickets. And overall, it ended up raising about $35,000. So after costs and things, I think we get a little bit more than 10,000 because we split the costs between the Access to Healthy Food Task Force, which our health education supervisor Tricia oversees, and Feed Northland Kids. So it was a really great event. They had tons of food vendors from different, or not vendors, but food people who are essentially giving out samples from lots of different Northland restaurants and bars. It was even like sponsored by like White Claw and Hy-Vee and a bunch of other restaurants. So between the sponsorships and the ticket sales, and then there was also a raffle. That's how they got that money. So right now, Tricia is working with Access to Healthy Foods Task Force to figure out what we're gonna do with that money. If we're gonna do some like mini grants, work with some of the food pantries, or if we're gonna do, there's been some interest in potentially doing like a Access to Food Summit. So right now determining what possible options there are with that.
And you worked with the event, Trisha worked at the
Yeah,
event.
I just attended.
Rebecca played at the event. No, Rebecca she came with her daughter Emma and her husband. And
We had a great time. It was,
we had
y'all should go next year.
yeah, it was a good
Did
event.
any other staff work it?
I think it was just us, and then there was some Clay County staff as well, and some of the other Northland Health Alliance partners were there.
I bought tickets and was not able to go, but my niece and her boyfriend came and thought it was awesome.
Yeah.
And they especially like not having to pay.
Yeah. Right. So it was a successful event, and they're planning on doing it next year, and they want to find a bigger event space and make it even bigger next year. So
Very nice.
pretty good.
And the Embassy Suites donated the space, right?
Right. MCC's are in the space. Lots of great sponsors. I was surprised how many sponsorships that they actually got. So
I heard it was awesome
yeah.
from everyone.
Yeah. No, it was a really good event. Yeah, what other big highlights? We have the Red Cross blood drive coming up. So originally we were gonna have our first blood drive in December. That ended up being the day that it snowed, so we ended up canceling it. But Cheyenne, one of our health educators, is working on planning this, so it's gonna be on March 3rd. I did include the link in case anyone wants to donate blood, but that's gonna be a good event for us, and I think we're gonna do that 3 or 4 times a year. So
And Cheyenne and I went and volunteered at the Katie Scott blood drive, which is the biggest blood drive in the Kansas City area. I am on the biomed committee with the Red Cross. And so that's the biomed committee kind of sponsors. So they asked that we kind of go volunteer, and I'd asked Cheyenne if she wanted to volunteer just to see what a blood drive was like. And so we went and we kind of checked people in, but she is really pumped. So if you know anyone who would like to give blood, please let them know that we are having our blood drive here on the 3rd. We have quite a few open spots still, but we need volunteers, and we will be doing the I'm blanking on the name of the machine.
oh, the blood,
Yeah, that one. Well,
no, there's the regular blood donation, and then there's Power One,
Power Red.
Power Red,
So what is that, plasma, or what are they going after?
It does double red blood cells.
but it's only for certain blood types.
This one, it'll be O.
Oh, for,
It's
O
only
donation, I think.
Yeah, I tried doing that, but I didn't have an option when I registered.
Okay. They're running out. There's a blood shortage and they have limited supplies.
I'll let them know.
We highlighted some of the harvesters data from last year. So we had 5,561 individuals served, which is the equivalent of around 35,000 meals. So some people come and they pick up for their whole family, and sometimes they pick up for a neighbor's family or a grandparent or other families as well. So we've had a lot with harvesters. This month also, we started putting in multiple dates with the harvesters numbers, so that you could see the past few months. Just down here further. So you can see over, we kind of did it similar to how we had done the epidemiology report. So it shows some of the data over the last few months. And November, October was kind of when SNAP benefits weren't available, so we saw a really high increase then. And then January was a really rainy month, which is probably why when we had harvesters that day, it was pouring down rain, and the harvester's truck was late. So we've had that happen a few times. So we're looking into possibly changing the time to be the first drop-off point, because we've had some delays with that. Let's see.
And the one thing I'll mention is while this is great for the community, we really do this as a drill for preparedness. And so while this is something that we love doing for the community, the real thrust for us is it gives us the practice every month as if we were doing some type of distribution event for, medication or
Vaccination.
shots or whatever it is. Because if someone said, hey, we have to set up to distribute stuff in 35 minutes, actually the people in this room,
Yeah.
we could be ready to do that. Because we do it every single month. We know where the stuff is, it's ready and staged to go. That's really the benefit. I mean, that's one of the benefits, but we know how to manage the traffic. We know how to do it. Where a lot of times where places I've been before, when you do it once a year or you do it once every 18 months, it's like pulling stuff out or creating stuff. Like it might take you 2 days to get ready for something like that. We can truly set it up in 20 minutes at any given time. So that's really the benefit. We know how the radios work. We know where they are. We know they're charged and ready to go. This is kind of, I always say it's kind of a side benefit, but now they're getting on to the data analysis and just doing some of the other stuff as practice on, like, so it's again, this is giving us real data just to be able to manipulate and use as like anything else, but it's practice.
And our new emergency response planner was able to participate in his first event doing this in January. So he had done previous clinics before. His name is also Andrew, and Andrew and I had worked with him at Cass County. So he had done COVID dispensing and was like in charge of ICS there. So he participated in January, and then this month he was the incident commander. Sorry, am I taking away your stuff again, Rebecca?
I can cross it off.
I do have a question quick about the harvesters things.
Yeah.
Does Clay County's health department do harvesters too?
They do.
Because there's a lot of people from Clay County coming over our way. 31 doesn't seem like a lot.
So
but
they do it the week before we do. So sometimes we get similar things, sometimes we get different things.
I go to both.
But
Mhm.
a lot of people who.
Also, Platte County people go there too.
Right. They go to
Ah,
multiple.
okay.
And a lot of them go to every single one that's on the list.
Right.
I got you.
Lutheran Church by me has a big one on Saturday mornings.
Every
Yeah.
week,
Yeah.
pretty much. Wow.
Yeah, Gloria Day.
Great idea.
Yeah.
And then our environmental public health staff, they participated in the traffic incident management responder course. So they were excited to do that. They said it was a little bit dry, but basically that's how to respond to a truck wreck or similar, just extra training on that. And then Bailey, our environmental supervisor, she
Can you just explain that? I mean, they may all know that, but
explained what a truck wreck is.
what,
So-
what kind of truck wreck?
So sometimes we've had truck wrecks, and I think the last big one that we had was the Chipotle rice one, and I think that was back when Dan was still here, and I think he included that in his report. So if a truck wrecks, sometimes they're carrying food or alcohol. I think we had one that was like a Crown Royal truck a year or two ago. So it can be damaged. So we have to go out there, inspect all the food, determine if it's still usable or not. Bailey did say that they're trying to move to less on the site, doing that kind of work and more trying to get it to once they've been taken to a tow lot to then go through the food or drinks so that it's then safer and that it lets people continue, because a lot of times this happens on the highway and they want to get the highway up and running again so that people aren't stuck.
But anytime there's an incident with the transport of food and it's distressed, whether it be water damage or by the environment or whatever, we have to respond and make sure that that food is controlled and not going to get out into the food supply system somehow. And so it's embargoed until it can be evaluated. And so that may take, sometimes it's temperature control, sometimes it's contaminated, sometimes it's on fire. Looks like a lot of different things, but it is always a lot of times very interesting. One of the things I'm very thankful for is that it has to be food that is not alive. So we don't deal with, if it is a cow and still walking around, we don't have to deal with it. If it's the beef and it's dead, and then we do have to deal with it, but I don't have to go chase
Chickens down.
the chickens down the road. And that I am very, very grateful for. The ones that are in packaging don't run very fast. But sometimes they do go down the hill and you have to go down the, and it's, of course, when this happens, it's usually the bad inclement weather that causes the truck wreck. So that's when we have to go, and that's what Taylor's kind of saying, is they're trying to figure out how not to have Andrew or Bailey or Kyle or Rachel out on the side of the road in this terrible weather and sliding down the hill, down the snow hill after the cans of pork and beans
Are all over the
As you can imagine, a
down
lot
to
of
the
times,
ditch.
yeah, and a lot of times it happens when there's snow or ice, because that's.
Yeah.
People are more like,
But
get in a wreck.
it's interesting. Trying to take pictures and trying to get people not to stop and try to steal the stuff. But it's always interesting. Go ahead, sorry.
Any other questions?
Yeah, can you go back up just a bit? So you had 6 places that you did inspections but you didn't do any re-inspections. So is that a good thing or a bad thing? That we didn't have the staff that re-inspect, or they're doing great, we don't have to re-inspect?
I think it's just that we didn't need to re-inspect,
Okay,
but that's just 1 month, so sometimes it's
And it
random.
could be their reinspection time has not come.
yeah,
within the
I
month
got
or
you,
two.
yeah.
What data on this report would indicate to a trustee that there's a problem going on besides counting on the staff to alert us to it? I've looked at these before and I'm trying to sort out, I mean, it's good to know that a candy shop inspection occurred. But is there more data that shows we're having trends or problems, or are there parameters that maybe we ought to be looking at? I mean, I like it. I'm not being critical.
Yeah,
It's a fair question, I think, as to what the critical data points are.
complaints are one area, but that's usually if someone calls and we get a complaint in.
Okay,
I don't know if we,
is there a line item for folks who needed to remediate? Or is there incidents of remediation or failure of inspections? I'm not sure how it works.
we do that right now.
Office Paragon can do that.
Yeah.
No,
we can
it's,
see if we can.
I mean, as a trustee, I like this. It's great, and I've really poured over it before, trying to see, is there something a few data points that might indicate that we should inquire more about it, but I know we don't have to do that because of the relationship we have with the leadership and staff, that you guys would tell us. But looking at a report, maybe 8 years from now, half of us will be here.
Right,
So we can,
yeah, we can,
at least on the food ones, we can see if they can pull the number of, they're no longer called critical and non-critical, but at least pull the number of, they're now like foundational and I forget what the other term is. But the difference is like critical are ones that we would require basically for the ones that require reinspection are the critical violations. So when we have a reinspection, that always means that there was a critical violation that could not be corrected on site.
Yeah, okay.
That we had to return on. But what you don't see from that reinspection number is the number of critical violations that were corrected on site. So we'll see if we can add some lines for just the critical and non-critical violations. That's not the nomenclature that will be used, but then you can at least see, and that won't be the case on like the sewage and the childcare and lodging, but for food, that should be a fairly easy number to come up with. and it'll give you a little bit more, kind of what you're asking, Dr. Chape. It'll give you a better
Thank you.
indicator of kind of what the flavor of when we go out. Are we seeing lots of problems, little problems, no problems? It'll kind of give you that flavor. Now,
That
we
sounds good.
can go onto the website at any time and see like all the inspections,
Okay.
but that's tedious. So we can give you kind of for the month,
Sure. If there was something to be alerted
but
about.
we can give you the
complaints,
flavor.
You know, I don't know what right. I'm very comfortable as a trustee in our relationship that if there were issues, you guys would bring them up
You would tell us.
way in advance. So maybe
I think this has
question
been
was silly.
geared in the past towards more of like what the workload has been. But we can certainly give you the flavor of what we're seeing.
Do you guys have a protocol for reinspection? Like if you see a critical problem, you'll be back within a month, within 2 months, or how does it
Yeah.
usually work?
There's
And
a,
you tell them ahead of time, we will be back in a month, but do you announce it? It's unannounced, or how does that actually work?
so nothing waits a month.
Okay.
So, and like like if we're coming back, it typically is a lot shorter than that.
Mm.
And it kind of depends what it is. And there's a whole operating
You have like
policy
an
on what
algorithm
it
follow.
is.
Okay, that's fine.
And a lot of the things are like, if a refrigeration unit's not working, like they can't use that unit until it starts working. Or if a dishwasher's not working and not usually it's because it's not sanitizing properly. They can't use it until we re-inspect it. So there's usually some urgency. You do not want to hand wash all your dishes. Like they want the guy to come fix it and they want us to come re-inspect it
Pretty quick.
and they want that done before breakfast.
Okay.
They do not want that to wait because they do not want to have to do that all in their 3-compartment sink. In fact, they're going to try to use all their dishes and have it all fixed because it takes like 10 times as long to do it by hand.
And if you're ever curious about a specific restaurant and what kinds of violations they have on our website, we have a place where you can go in and look up specific establishments and see. I mean, and sometimes it's like small things like, oh, they had a cracked tile, and like sometimes it's like, oh, they had chicken sitting out for up and it got up to a temperature that's outside of the danger zone, or so I mean, there's varying levels of things. We very rarely have like closed down a restaurant. It's usually like, oh, you need to throw that chicken away, you can't use it, and more things like that. Or things that, yeah, and a lot of things they get just fixed on site as well.
Super roll.
All right, so going on to January, so it's kind of a slower month for us. So a lot of it's like just getting refocused, preparing for what we're now doing in February, which is like a lot of back to school clinics. So we're actually a preview for next month. We're actually hitting record numbers of kids participating in these immunization clinics. We did at one of our first schools, we had over 100 kids sign up. Typically, we're averaging like 25 to 30 in the years prior. So huge volume coming in this year. We are working with Park Hill School District again, having the students come in here and like shadow with all the staff. I know they love it a lot. I keep getting lots of kudos from Bailey. They just love working with her and like her team and learning about all the stuff that they do. So I'm very appreciative of everyone kind of helping out with that. They did do a new thing for that program. Typically, they'll get like a 2-step TB skin test whenever they go for all their clinical sites. Some of the sites are actually requiring like a TB blood test now. So we had them actually come here for like their classes, and then they just hung out in the conference room and one by one came back into our lab, and then we just collected all the blood samples for them and just got it done right away. So it went pretty smoothly. Blood TB tests to do in like an hour and a half period for that many students, but it worked.
That's the turnaround time, an hour and a half?
That's the entire time they had for like their class that they were here in the building. So we had that time to get all the tests, like the blood samples collected. We sent it off to Quest and then they'll run them there.
So it takes about, what, 2 days?
Usually about 3 to 5. They'll let them incubate for about 2 days, and then they'll run them in batches. And then if one of if the sample turns out positive in the batches, they'll start testing them individually just to help reduce costs on things like that.
So
But
that's better than just coming 2 days to just get boom tested, boom, boom.
it depends on, like I said, it's more of like some hospitals' policies because like it's subject to interpretation if you do a skin test, as you'll have like the definitive answer when you get like a blood test there. So a lot of places are starting to crack down more on that. I know there's like some colleges, even when you're enrolling in like medical school or nursing school, like they want the blood test and no longer accept the skin test anymore. So, so we're continuing working on that. We did have we've been working on updating a lot of the referral information, as well as working on some more education to be available in multiple different languages, because we are seeing quite a few patients who are needing like language services. So trying to have it easy to understand, pretty much like graphics and things so that they can easily like, learn a little bit more about some of the foods that are primarily in America and like how to best prepare and cook them, because if you're never been around this before, you're not going to know how to cook it and prepare it. So they've been working on some of that stuff. And they're also like, working on some more online education through wakehealth.org, which teaches a lot of nutrition training, breastfeeding education, healthy foods, and various things like that. I did meet with Swope. They are going to try to work on a new format to sharing what their customer satisfaction survey is. Dr. Jamal had expressed some concerns because they'd seen it at some other clinics where people were like filling out their surveys at other sites, but then they'd also go into like Google or Yelp and like make comments on there. Her concern was that it made more easily link people to like for HIPAA violations, saying if this person wrote this same exact comment and then had it there and we were to present it here, that was her concern, was having that be someone could identify that person based on their comment. So they're going to try to just break them down to each individual question and try to get like that average score for each section they're trying to look at in their survey. So I'll try to have all that ready for next month too. But as you can see, they had a pretty good month this year compared to the previous year. So they are still working and pushing. We're getting more information from them to get onto like our digital displays, kind of promote their activities and things. So that's my big report. And then just a breakdown of what we did in the clinic services this month.
Did you get rid of all your flu vaccine?
No.
No.
How much
Trying. We went to a few different offsite places. We had one of the daycare centers want us to come and vaccinate their employees, so we went out there, did that, and then we went out to Mid-Continent Public Library, did a few vaccines there. But yeah, we reached out to several of the different daycare centers and other places, and just not a lot of people were like fighting to get it. But we were working on having a little Spotify ad over the weekend, kind of trying to promote people here to come in and get like, they're just walk in and get your flu vaccine. Jill's on vacation, so I haven't had a chance to get with her and like see what the actual metrics were, like how many people actually got to hear it and then feedback on that. But hopefully a few heard it and will come in, but we haven't had anyone yet mention the Spotify ad. So
we ordered 300 total. What did we do?
300. So we get.
So we still have about 80 left.
Yeah.
Okay. And that's, have we been keeping a trend year after year?
Yeah, I keep track of what we do for each
So
vaccine.
is 80
So
reasonable, not reasonable? What, compared to last year, how much?
Oh, I'll have to go back and look at get you an accurate answer on that.
Cause didn't we order 500?
I think we've ordered 500 last year.
So we
That's what we
ordered less this year.
It was still too much.
Mhm.
Okay. Do we get, it's not like we're getting dinged financially for ordering 300 or something.
We get some credit back for the vaccine we don't use. So normally we'll be in that range where we get reimbursed for it.
Okay.
So it helps out. Like one of the things we've been seeing the past few years is so many places are offering like those
We got a lot of choices.
rebates or fuel savers.
Fuel
and things
saver.
like that. So,
Okay.
I mean, we ordered a lot less.
Yeah.
But we still ordered too
Like
much.
there's definitely more places to get it
Mhm.
now than there ever have been.
I will say the big exception was so Flu Block, the one that's licensed for 18 years of age and older and is egg free. Actually, we ran out, and they ran out at their level to where they couldn't even order any additional doses of it. So that was the one that really went well. So,
Okay.
All right, I won't spend too much time on this, but we did, again, we received the amount for the accreditation assistance funding. I do want to thank a lot of your bookkeepers, because what helped us get that amount was that we justified down to the penny why we needed each bit and each amount. And I think that's what helped get us there. So your bookkeepers helped me say, let's make sure these numbers are right every time. So that's going to pay for portions of my salary, the deputy director, the director, the emergency response planner, the environmental public health specialist, epidemiologist, and public information officer. So that's seven positions that have a good bit of funding to help subsidize their positions. Additionally, I touched base with the accreditation specialist. We've been assigned from FAB. She's the first one to look at our documentation, and then she has someone else look at it as well. And when I talked to her, it was a couple of weeks ago, but she said, at this point, I'm halfway through. I've seen no major issues, so I'm sure we'll have some reopen measures. But at that point, she had not seen anything wild, which is great.
Yeah,
But
awesome.
yes, I know that was what I wanted to hear, not, oh man, hang on to your hats. So they kind of expected for us to get the reopen measures back about mid-March. So we're, trying to look at how we're gonna tackle that. Let's see, so down to quality improvement. Back in November and December, we had not heard about the accreditation assistance funding. And without it, the budget was going to be extremely tight. And so I know I always want to do more trainings to better improve myself and bring more to the position in the health department. So actually through my husband's unit in the Air Force, I was able to apply for a program through Syracuse University where I'll get free Six Sigma Green Belt training. And then it's a quality improvement training that's pretty well renowned in a lot of sectors. So it's going to I'm going to be a cohort of all kinds of veterans. They started letting a few spouses in. So my husband's unit really went to bat for me there. So it'll help give us some more methods for quality improvement. So we can just keep looking into all of our processes and systems and make them better. So super excited for that. Thank you, Taylor, for letting me apply.
Congratulations.
But, yes. So we got the extra funding, but a penny saved is penny earned, and we can use more money towards other trainings for other people.
Sure.
Yeah. So there's that. Let's see. We're working on our workforce development plan. We're actually updating our training. We don't really have a central location for every training that everyone needs to take, from new hires to what each division needs. So we're looking at centralizing that, so that when we have a new hire, we know you need all these things, you need these by these dates, just to make these processes faster and easier. And then, here's where you go to get the training. So that's going to take a little while, but we're working on centralizing that. We're also updating our policies and procedures and making sure that we're kind of standardizing those. We have been reviewing our old policies, and we have found that they're all in one spot in the shared drive, but there are lots of copies of them in different places. So we're looking to consolidate so that we have one source to go to things. Additionally, I think they touched on it a couple of times, but when my various meetings and presentations throughout the month, I share every resource we need to for accreditation. I shared our strategic plan and workforce development plan today at a meeting. So we are working on sharing more resources with more folks, especially if people keep texting like, have you gotten your feedback? Because they're going to use that to help better themselves as well. Additionally, it took Incident Command Systems ICS 300. Of course, this past month, this is put on by the Mid-Atlantic Regional Mid-American Regional Council. We're not in the Mid-Atlantic. So that it helps us to understand, for incident commands, how we can standardize those processes and work with other agencies. They put it on this because the World Cup is coming. And this allows us to kind of not only get used to those forums for incident commands, but also reconnect with some partners. So I went down to the Kansas City Firehouse and took this training with a lot of chiefs of fire departments down there. And then we finished watching the infectious disease preparedness series from KU Med. Really good information, because if we they're expecting 65 650,000 people to come in for the World Cup.
All over the world.
Yes, from all over the world. So they expect us to see different diseases. So like
That actually is a good point. Is this gonna be like the command center for that, or what are they gonna do? Is Missouri taking over this place to make this a command center?
So we are working on it from several different fronts. We're not going to be the command center, but we're working. Everyone here is working with several different groups on different things, so,
Well, they're all coming right across the street.
right. But then they're going different places, so,
Yeah.
you know, even environmental is like, it's all kinds of different aspects of it. I mean, from lodging and
Right.
food and like, just all kinds of aspects of this, you know, crowd control, like
Right.
everyone's involved in it in some way or another. A lot of it's going through Mid-America Regional Council, but all of us are involved in different portions of it.
What months will that be?
June 11th through July 19th.
So
Yeah, over the summer.
5 weeks. Yeah.
And
I mean,
when
we're
you're
talking-
gone- And when you're gone, we're renting out your.
Yeah, I know. I heard.
Yeah.
So,
I'm making money out of it. I got a cut. So.
Yeah.
No, so I was gonna say, if you're gonna have exposure to measles,
Yep.
TB, the whole shebang.
We had one series on just rashes, and it was slide after slide of name that rash.
Yeah.
And they do them from 12 to 1, so I was always eating my lunch during name that rash. But yeah, it's helpful to have that data compiled so that you can use those resources. But we would obviously be doing more of, okay, they need to borrow our radios, you know, or let's say there's an outbreak, even if it's not here, we might be asked to help do case investigations for other jurisdictions if they get overwhelmed. We're not sure, but we want to be prepared for what.
I'm glad she's so optimistic that it won't be here, but
It probably will be good. So
I
what
know,
are all the different stadiums are using? So Arrowhead, the KC Current Place,
Yeah.
the Sporting KC. So that's 3. Is there another place?
I think it's just those 3 for practice stadiums, but then I think
There's like base camps, and then there's like festivals and
Right.
other big gathering events.
That
too.
won't be here. That'll be downtown probably, right?
Yeah,
Probably,
they might
yes.
go to Memorial, I think,
Yeah.
for the big
But-
ones. Or
so much of it is just all the people.
Right.
Yeah.
And they're just staying every place.
Right.
You know, everyone's doing, you know, the VRBO and like all the restaurants just, you know, like some of it is just like we've heard from the state environmental folks, make sure all your inspections are caught up for all your hotels and lodging and for your
Yeah.
restaurants and everything, because just the influx of people, and then, you know, if anything goes wrong,
Yeah.
if there's one outbreak of anything, it's going to be a big mess.
My understanding is that there's a great possibility that Ronaldo and Messi might play each other, right?
Ooh.
And if that does happen, everybody's gonna be flying to town to see that.
How's that an infectious disease disaster?
You got people from all over the world.
Yeah.
There it is.
Messy.
Oh.
If that happens, that's like the Super Bowl of soccer, if those two
Yes.
play each other.
Yeah.
Yeah.
Be the last time that they
Yeah.
play each other and something like that too would be, big deal. But yeah, I mean, the aftermath of when everybody leaves is also gonna be something that, I mean, our inspectors are gonna have to probably plan on, I mean, probably setting up hotel inspections and things like that,
Bed
because,
Yeah,
yeah,
Don't even
that's
talk.
for certain going to pick up.
yeah.
But
Well, they
what
just said
they're
it's not
saying
that
is,
bad.
you know, there won't be a
The cake
hotel
kill.
room within
Time of
like
the year.
100 bucks.
Patients
Oh,
come in.
yeah, no, I know, but that's where I'm like, there will be some real friends that get in people's suitcases,
They do.
make their way.
Well, and it's a big party too. So
Yeah, there'll be other types of diseases that will be taking place.
Yeah.
Dustin, be ready.
Yeah.
Yeah.
Mm-hmm.
leave it down with them, it's fine, but no, we got enough.
It's gonna be a fun time for all.
Yeah. So yeah, we're preparing with our partners to either deal with or assist with whatever we can.
I sent an email to all the staff when, like, we got an email from the state environmental folks, and I copied all the management team. And I'm sure they were thinking, why in the world are you sending me this stuff for the restaurants? And I'm just wanted everyone to understand, like, just get in the right mindset about how all encompassing this can be. You know, it's going to come when it happens, it's going to be something weird that we just aren't thinking of
Yep.
how this impacted everybody.
For 5
And
weeks.
Cindy's going to be like, oh, I did not know how this is going to impact me. And she's going to be right in the thick of it. It's going to be like, oh my Lord, this is a pain. Like, we're all,
Yep.
all drenched in it. So,
It's gonna be great.
Yes. All right.
I think that's all. Sorry.
so, just need to, well, I think we need our, Susan, do you have a report from the finance
Sure.
committee?
For the finance committee, yes, we met on the 10th, morning of the 10th, and thought it was going to be a very not long meeting, but it ended up being long because we talked about everything, I think. But the main things that we discussed were the merchants service equipment, and we're still using the equipment that we have from Central Bank, but we're going to eventually switch to Nottaway. But right now, we're still using the Central Bank systems until they can review and see what they specifically want. And then we did discuss the grant from the DHSS. And we're very happy that we got that to help with the budget for the 2026 year. And thanks to Taylor and Rebecca for their work on this and all of their good communication with the DHSS. I think it probably played a part possibly in terms of how they looked at us and what we needed. And we talked about the electronic doors, which I think is coming up a little bit more on the agenda, going from keypad to key card. And that's about it, I think. I don't know if you want to add anything else, Andrew?
No, I think that pretty much is that just the merchant services equipment that you mentioned is basically the credit card equipment that we use to take point of service or point of sale, actually, the credit card machines, and those are no longer supported. They still work. They just aren't getting updates, so they need to be changed out. And we'd originally looked at just upgrading them, but to do that currently, we would just upgrade them through Central Bank. Well, we don't use Central Bank, so I'd like to get them from Nottaway Valley just to keep everything consistent. But that takes a little bit of research. And according to Cindy, who's always whining, I'm joking, her people are just kind of overwhelmed with some other projects right at the moment. So I said, there's no urgency as long as they're working, they're still secure, there's no.
How many machines do we need? Three?
Three, right?
have three
Three.
currently.
So
And the ones that we have right now still work? They're just
still work, they're
not
secure,
supported.
there's no breaches. We just will need to get them taken care of probably within the next 3 to 4 months, so. And we'll get them taken.
Did we already, hey Susan, did we already deposit the money for the account that what it was like 250,000 or whatever? Was that a done deal? Or we signed that? So that's,
Yes.
what was the final, what was the interest rate that they gave us for that? Do you remember?
It's on the report here and coming up will tell us. I
Okay.
know I read that in the agenda.
Right.
This will probably be a good time since we're talking subcommittees. We are having a bylaws committee meeting on Thursday, February 26th from 3 to 4.
And I believe that should be on your calendar, Dr. Chalfant. So I believe you serve on that committee.
3 p.m.
Yes. And for the even number years, we updated the bylaws last year, so this is just a review. So as far as I know, no board members have submitted any bylaws changes. So the meeting should be actually fairly quick. Just ask that everyone look over them, see if they have any changes. If we have no changes, I mean, we do have to meet.
And are the bylaws accessible from the website?
Yes.
Yes.
But they're, and the updated, it's the updated ones. But there shouldn't be, it should not be a very long meeting.
Hey, Susan, are you gonna be in town anytime soon?
I will be back in town in April, the first couple of weeks, so we're not for sure when we're coming back, but we should be back.
So she,
Somebody else can sign.
somebody else, okay, good. There's some forms for you to sign, but we'll have somebody else do it.
Okay.
Yeah.
And Cindy, do you know the final of that, CD, that interest rate?
I was looking through.
I
here
thought it
too.
was in the, I thought it was in the agenda.
3.95.
We keep,
We may have to get back with the board on that. Cindy, will you get that?
Yeah,
Was it anything that was like surprisingly good, surprisingly bad? Just kind of, you got the best that you
I
could.
think it was 3 something, but I can't. Can we go to
And-
that, the page? I swore I thought I saw that. on
And it
there.
was, for 6 months, right?
It was for 7.
7 months.
Okay, okay.
I had written down 3.95%. I think. I'm not sure, Susan, what page.
3.9.
Oh, I was thinking it was,
Right here.
Are you looking at the minutes?
No.
Because that's not what we ended up actually doing. If you want to move on, I'll find it.
oh, I-
Pseudo treasurer.
Okay,
There's
I think
not
next
5 or 6 forms. to
is
sign.
approval of the bills.
okay, I'm wrong. I thought I saw it. I guess it was those other ones.
So we review and approve bills.
So,
Is that where
okay,
we're at?
let's do there a motion to approve the bills.
I'll move that we approve the bills for the month.
I second that.
Okay, any further discussion? Susan,
Yes.
Kim,
Yes.
me, yes. Mike?
Yes.
Zach? Yes. Okay, next.
So can we go back to the CD? It really
Yes.
irritates me that Taylor is right.
You don't believe me.
So what is it?
3.95%.
That's actually really good. Right?
Awesome.
For what it was, the
Yeah.
meeting that I went to, that's actually really good.
And it was for 7 months.
Got a
So
good memory.
the maturity date,
Well, I looked at my notes.
it was
Well, that's what I
8/23 of
thought.
26.
Yeah,
And we opened it on 1/23 is when I signed.
that's actually better than our money markets, right?
Yes, because they're like 3.3 something, I think.
Yeah.
I wish I had Taylor's memory. It's been a while since I've been able to remember.
Now, when they gave us the 3.95 or the 3.95, was that you had to do the 7 month, or was that just the going rate for if you chose with 5 months, 6 months, 7 month, a year? Was it variable?
It was variable based on the term, and that was the best one.
Okay, all right.
And longer wasn't actually higher.
Well, the meeting I went to, you actually went lower the longer,
Yes.
yeah, that was
Yeah,
weird.
I think they're all like that.
Yeah, they want you to do short term.
Mhm.
Yeah, that's weird. I guess not weird for them. They just want you to re-up and get a lower interest rate when you do.
And they,
They can't predict what the Fed's gonna do
No.
with
Yeah.
the rates, and it creates risk.
and they had a 7 month. So Nottaway had 7 month was their kind of thing.
Mhm.
They did say they would do 6 that if we wanted, but that wasn't their normal thing. But I had told them, well, you don't need a 7 was fine. That still fit within our spending pattern. Maturity of 8/23 was fine. It wasn't going to mess with our stuff.
Right.
And it gives us an extra month of the interest, so that seemed like it was a good deal for us. And that was, I think we had put that into the board motion, so it all worked out fine.
Okay.
So the next thing is access control for 8 interior doors. So some of you, mainly I think Dr. Kingsley may remember when we built the building, we had looked at access control for the doors. We did not do access control for every door. We did it for a certain number of doors. It was about $2,000 a door when we did it, when we were putting it on the building. And the basic gist was, let's not put it on every door. We don't know which doors we're actually going to use it on. And let's see what we actually are going to need. Well, we will be in the building on May 1st of this year for 3 years. And you will see that there's 8 red dots. Happens that there's a controller that will do 8 doors. So it's a controller that does 8 doors. And those 8 dots represent actually these 2 doors. That door behind you, Kim, and that door. The 2 doors to the staff break room, the 2 doors that are for the receptionist and the door behind her, then the door to the waiting room, and then the last red dot is the far east door, which is the one that goes to the backside of WIC and then goes out to the garage. I'm requesting board approval and it's 14,000. Taylor can probably read you the number, but it's 14,000 and some change to get access control for those doors. It's either because of frequency of entry or necessity for public access. Like some of you have noticed, maybe if you try to come in this room, like if we have that door closed, you can't get in. Well, imagine that during the day, when we actually use this room. People can't get in. And what that will enable us to do is set it on the schedule. So these doors will always be locked or unlocked. So
Is there a recurring cost associated with the server?
no.
I mean, the controller, AKA it's a server.
No, it's,
And is there a significant cost for these cards? Is there only one vendor? Because I imagine they're RFID cards.
they are, but what we have, it's all built in.
It's cheap, it's inexpensive, and okay.
It's,
I had to ask the question.
Yeah.
So the codes that you have on the door here, so the code is that the only one that has a code thing on the handle like that, or are there the doors that we're changing, they have that?
they all have that.
And is it a different code for each
No,
room?
it's all the same code.
But
We have 4 different codes, I think, but most of them are all the same. The issue is like the codes for the staff break room. Since we've been here, those doors have been probably activated by the code. Oh, I'd say probably 15 to 20,000 times. That probably is not the greatest use of staff time. I mean, it adds up. The one where our front desk person sits, every single time she leaves that desk area, she has to re-enter the code to go back into her office. And it's
All of
actually,
the other access control, doors that you have in place now will be integrated with this into one.
it's all the same system.
Correct. Okay. So this is going to allow you to secure and make flexibility for the building in the future if you change where things are located.
Right. And the other thing is like, so here, it's mainly kind of like for public access. For the staff break room, it's kind of like just more of an access thing for staff. But like for the reception area and where all our computer equipment is, for me, that's more of a security issue. I know who is going in there. If anything ever happens to any of that computer equipment, it's also where we keep all our keys. If there's ever a security breach, I know who has gone in there because it's every time these keys cards are swiped, it records who has gone in there.
Well, you know who swiped. You
Right.
know whose card was swiped.
I may not know who had the
Yeah.
card,
That's true.
but I know whose card was, and I can also turn these off.
I'd make a motion to approve the funding for the 8 security doors. Move to authorize the director to purchase equipment and labor to equip 8 additional interior doors with access control at a cost of $14,374.43.
Is there a second?
A second.
Further discussion? Susan?
Yes.
Jim?
Yes.
Me, yes. Mike?
Yes.
Zach?
Yeah.
Next?
So you all know that I meet with Dr. Kingsley every month
I know,
and he knows this.
I know.
But I always give him a hard time because he likes when he has good ideas.
Mhm.
And so, can you scroll up?
I get them every once in a while.
So in your packet, you will see my letter to the commission, just with our profit and loss statement. Now, we do have to send our profit and loss statement to the commission every year. But we typically had not until maybe a couple of years ago, kind of given them just a little bit of explanation. So I just kind of told them like where we were. You know, the commission had some questions about our overall fiscal health. And so this is just a little bit about where we were, you know, a few years ago. And there's actually a typo. So they got one with the typo because that last one should be 26. So I apologize for
Yes.
that. Now I see it glaringly. I did not see it when I wrote it. I blame Taylor. So actually, she wouldn't make that mistake, but
Do you want my red pen?
can I go write it up off there? But anyway, just wanted to share that with you all.
We don't
share
have
my-
to do it. We're just being neighborly,
Yes.
and I appreciate that.
And then the next thing on here is the March board meeting. I will not be present. I will be online, hopefully. So Taylor will run the meeting if I can't do it, but I will be virtual. Hopefully I will be able to do it
Do
virtually.
your thing. It's not an emergency.
Well, I'm gonna try to do it virtually. And hopefully I'm kind of jealous. You guys get to do it like with great backdrops and
It's gotta be cool though. Don't be
I'm gonna
dumb
try to
lame.
do it nice.
Okay, all right.
No prison cell.
Okay, Taylor, can you go on to the next thing?
Well, I will be on a cruise, so hopefully it will be that kind of fun backdrop. So we'll
Sounds good to
see.
me.
Pay for the Wi-Fi package out of the budget. It's a business expense.
Good call.
I do it all the time.
We'll see.
Not this budget.
And then our last thing is personnel action. I think this one's questionable whether I recommend it.
Sometimes people make mistakes.
It kind of depends whether this person is going to buy me lunch. No, I'm joking. But this one is for Emma Rowe, who you were all introduced to. She's been hired as our full-time public health nurse team lead effective February 9th, 2026. I think I had mentioned that for all of our new staff on their first day, we have tried to take them out to lunch as a welcome, the managers and myself. I think that has been going pretty nice because a lot of times our new staff don't get to meet all the management team. But it was very nice to get to meet Emma and to talk to her and to hear about her potty training challenges with her little girl. How's that going?
Oh, I haven't started yet.
It was me.
Rebecca that's about-
I'm the one who started and we are not anymore.
Too soon, too soon.
We all cried and it's over.
Yeah, nobody did chores.
Yeah. She wasn't even 2 yet. Ian was ready. So,
So, do we have a
Yeah, do we have a motion?
motion to approve?
Crickets.
I guess not. All right, let's move on to the next thing. All right, I make a motion to approve the hiring of Emma Rowe.
Second.
Any further discussion? Okay, Susan,
Yes.
Yes.
me, yes, Mike,
Yes.
Zach,
Yes.
congratulations, you're eligible.
Wow, that would have been embarrassing.
No, raking her over the coals and then not doing it would have been embarrassing.
And nothing for executive
Okay, good.
session.
I was gonna say, you didn't tell me about it. All right, so, I guess our next meeting will be March
Yeah.
19th.
New
Oh,
business matter, more of a question.
Go for it.
You and I had some discussions about if other Platte County entities might be able to use meeting space here. Is that something we need to put before the board, or is that something that the director can?
well, Andrew and I have kind of talked about it, and so if you wanna, do we have space that, if other government entities could have meetings here, is that okay or not okay?
You know, I have zero issue with it. If you can just let me know in advance times and dates.
Just,
And
I didn't
we'll
know if
work
there was
it
a
out.
protocol, if it was something the board needed to do. I'm gonna mention it to our commissioners and to a new board that's being formed. And our next meeting is March 4th, but it's already been established and set out where we're meeting. But moving forward, there may be a need for space. Until
Utility-
Is that
January.
for the mental health?
Yeah.
Yeah, the ad hoc, well, I'll just tell
Which I'm
everybody.
sorry you weren't.
No, I
Uh,
like to.
In 1980, the citizens of Platte County, along with the citizens of Clay and Ray counties, agreed to fund a tax levy for the funds to be administered by a 9-person board for the health and mental health needs of the area. They pretty much met very infrequently, but at least annually, they approved a budget that was more of a grant-like nature. They would grant a lump sum to Beacon, a lump sum to Synergy, a lump sum to the drug courts. Over time, there was lack of accountability. When the commissioners wanted to go in and see how much was being spent on other counties, the county was challenging at best. At a minimum, we could see that the citizens of Platte County were paying about $800,000 to almost to $1 million a year towards other counties.
Mhm.
So the commissioners gave notice before the end of this year that we're going to withdraw from that. And they formed an ad hoc committee to try to figure out how to form a 9-person board to administer those funds all within Platte County. And it's about $3.5 million. So we've got this ad hoc committee that's meeting. If anybody is interested in serving on that board, you can go to the website, the Platte County website, and put an application in. If you know individuals you think that would be good to serve on that, please get them nominated, because the advisory board is going to look at the applications, decide on the structure of the board, and then that board has to hit the ground running. This is not a come in once a month board. It's going to be a lot of challenges, a lot of work until January.
Do they have to live in Platte County or can they work in Platte County?
On the board, you have to be from Platte County.
Because you had someone in mind potentially, Sue, right?
Yeah,
that
I
you
had
thought-
a social worker from the high school that would be awesome, but I don't know she lives in Platte County, but she does work in Platte County. So-
My sense of it is that they've specifically put that question on the application
Okay,
because I think it was I don't know, there was no vote taken, but a general consensus was you want Platte County citizens to making decisions about the money,
Mhm.
unless it's such a unique person, they bring something to the table that we can't get
Mhm.
elsewhere. Somehow Kingsley made me chair the advisory board. It's getting started, but I think he and I may both be volunteering to serve on the board, but the advisory committee has to make those decisions. But the only reason we didn't try to get you guys on there is if three of us met there,
Then it's,
Then
No,
we have
I
to
just
post
wanted
a
to
meeting.
listen in. No, I wanted to just hear the
Yeah.
overall, I had an overall interest in what the outcome of that was gonna be and the decisions, that's all.
right,
So,
and
Yeah,
I think the biggest thing that I called into some of these meetings with Commissioner Fricker, the lack of accountability was concerning. Working with the health department, working with the Board of Services, everything is fee for service. If we do something, we pay, but we also get a receipt back. And there was none of that. And the board that was running it really they didn't think that was that important. But if you're trying to do accountability, very important, transparency and accountability. So that was the whole impetus that led to that. So hopefully the services will be the same, if not better than what the Platte County citizens already have. That's the intention anyway. And that's why you say we got to get off running, because the last thing we'll do is January 1st comes and then the thing doesn't work. That would be horrific.
you gotta decide if it's gonna be fee for service, when can you implement it?
Yeah.
I've done research on HIPAA and everyone who's if we're gonna have them tell us who they served, where their residence was, they're gonna have to sign a HIPAA waiver. Because technically they'd be billing us and government, anyway, so there's a lot of work. We're gonna have a lot of attorneys involved to make sure the logistics, but you see, there's no money in the budget to do anything. So we're gonna have a lot of
Dr.
people
Sheldon.
doing the heavy lifting, because we're not gonna be able to hire an administrator.
Mm,
Part of this next meeting is gonna be, can we get funding to bring an administrator on board, start a search? Can we get them on board before the funding hits? We're gonna do a prelim budget. It's gonna be a lot of brainstorming with.
and I
The
would like to
community-
just, oh, go
Go
ahead.
ahead. No, you
I
go.
would just like to clarify, I know I had, in the past had said I didn't want the Platte County Health building utilized for political meetings, but to me, mental health is a health issue and I have no qualms
agree
about
with you.
meetings being held there.
It'll be a government entity. I was just gonna say, when I called in for that meeting, our telecommunications here blows it out of the water.
Yeah.
This place is pat yourselves on the back on that one. It's so much better than what we have for people calling in, virtual, all the meeting stuff like Susan. I can hear her perfect. When I was calling in, I heard only like every 2 or 3 words out of 5. So this place is a superior location to have
Yeah.
meetings.
Well, and Susan, just to your point, I'm not looking at it as any kind of political
No.
meeting.
Right.
I'm looking to
Thank
it as
you.
a
Because
different.
I am with you. There's no
This is
role
a
for
health.
health department,
Yeah.
period.
The one thing I would ask is one of you, before that happens, I need to know how you need the room set up, and then we need to talk logistics.
It'll be
Okay.
after March 4th, because I'm not gonna throw a wrench in the system and suggest a change in location. Wes sent out an email of the meeting time and everything else. Everybody's expecting to be there. I don't wanna hijack what they're doing, but I know I have to start working on an agenda.
Where do people find the application?
yeah, so I can put, if
Ah.
I know somebody.
Yes, we need quality people. So
Won't be
Yeah,
me,
because
but
I have a few I think some people from the
knowing
school
how-
district and the high schools with all the mental health would be.
But could we close this?
yes,
meeting?
let's finish this
Go on.
meeting.
Yeah.
I apologize. I hijacked this.
Well, no, the question was, could we
I
use
wanted
the facility?
everybody,
The answer is
all the
yes.
trustees to
Yes,
be aware. I wanted to get administration's input because it is not political, it's just logistical. And I
Yes.
think it benefits the citizens of Platte County to have a
Yes.
good meeting space. If maybe
It's
the
mental health.
the whole group won't want to come here, but I just wanted to make sure we were all okay with it. And then if they do want to come here, I will make sure the logistics are ironed out.
Yeah, and I can help with that.
Great.
I will be here to provide tech support and.
Right.
Take care
Well,
of
actually, you
that.
listening in the meeting would be helpful too. You have a kind of stake in this all,
I
sort of.
probably will not be doing that.
sort of. But I mean, we do
We'll just
here.
I'd
That's
like to
fine.
make a motion
That we
during
had
the meeting.
Yes. Is there a second? Any further discussion? Susan,
Yes.
Kim,
Yes.
me, yes. Mike,
Yes.
Zach,
Yes.
we're good. Thank you, everybody. Next meeting will be, let's see, it'll be March 19, 2026 at 6 PM. Thank you.
And hold on, I'm waiting for that info for how you